questions. Okay, so first let's pass it over to Dr. Diaz.
Thank you for the invite. Very excited to join the group and to share experiences and ask your questions. I will be very sorry to let you know that for family reasons, I have to leave at 4:30. So if the coordinators agree and you have questions after my presentation, please interrupt me, stop me, and I will be able to do that. I have 20 years as a physician, and my journey started in Venezuela. I'm South American, and I have the luck to be chosen after so much hard work, and I will go in details, to go to a very prestigious medical school. In Venezuela, unlike here, the pathway to get to your journey in any career is to definitely have an early idea on to what are your aspirations and your main goals. Not necessarily you need to be super clear what is the profession you want to end doing, but definitely if you want to have access and options, the early you start looking into exploring those options will help you. And the higher the scores you get when you are in high school and middle school, definitely the better for you. So at least I had that clear thanks to the support of my family. And I wanted to really have options. So when I was in my last year of my high school is when I really kind of start getting the clarity of who I was. So for any career you chose to follow, I think the most important thing is to know who you are. What are your passions as a person? What are your kind of strengths and opportunities? And one of the things that I identify early is that definitely I was a people person. I love to be surrounded by people. I love to talk with people. And the most important thing, what gave me a lot of joy, was to extend a hand to offer my support, especially at the educational level with my colleagues, or working in the community and serving the ones who had nothing. So I would say that that gave me so much joy that it was kind of at the end easy for me to decide that I wanted to have a medical career. Then medical career is very broad, especially in the United States. You have different levels: MA, LVN, RN, nurse practitioner, PA, and physician. So it's like all those steps to follow. And for me, I only in my country were either a RN or a physician. PA is not existent, and we didn't have these degrees of medical assistants or LVNs at that moment. Then I realized that definitely I was a leader, and it was hard for me to have a boss telling me what to do, and not having the authority and probably the initiative to take decisions on my own. And that's why I definitely choose not to become a nurse, but to become a physician. I never look at my career as an opportunity to make money, because I think that will give you so much dissatisfaction at the end, but an opportunity to enjoy my life, to give myself every single day, to go tired to my home and think and feel that I touch somebody, that I change somebody for good, or at least that I offer some good advice. Uh, I finished my high school, and I was number one in my class, and I was ranking one of the 10 best for my area in general. I was a big city, Caracas, and I had the chance to choose which school I wanted to go. And there was a tiny school that only accepted 65 students per year, and that's what I went. And I had a wonderful journey of 7 years, straight medical school. We don't have pre-med. We just go into medical school, and it was very rewarding because it was hands-on from the first year. So for those who has family somewhere else in the world and you have the chance to do a free medical career, consider. I paid nothing for my medical career. When it came to the United States, I was already a physician with a training in internal medicine. I did internal medicine in Venezuela. I had a year of experience in rural medicine, serving very poor communities. And my batch for grad students, now doctors, was really diverse. So my country is a very diverse group: ethical, cultural, religious. We were really diverse. So I couldn't feel that disparities that sometimes we talk about and we feel and we see in the past. I came in when I was 32 years old, and I married a very bright physician as well, who already completed all the training that you're required to become a uh, credited or a physician, a legal physician here in the United States. It's done through USMLE, and we have to take the regular test you will take when you get to med school. Step 1, steps 2, step 3, and the step 2 had 2 steps: step clinical skills and the I think it's like practical skills. I don't remember the name right now. And with that, you are ready to apply to a residency here. So I did internal medicine again in Brooklyn, New York, in a hospital that probably wasn't that prestigious, but gave me a wonderful, wonderful experience. I was serving a lot of Hispanic population, African Americans, few Asians, and a lot of Polish. So I learned some few words from those ethnical groups, and the most important thing, their culture that is being embedded into my life. Then I had in my last year of my residency, and I don't want to go in details because we're going to talk about the medical career. I have to tell you that looking backwards, there is nothing that I would say it changed or will change the way I grew up as a physician, because when I felt that I needed more support, I asked for help, and they guide me to either get more support or practice more or study harder, and that helped me out. And going in details of if how happy I feel about being a physician, I think it's like I will do it over and over and over and over. If I'm not a physician, I don't know what I would be, because I am a community server by heart, and it's such a joy. So I enjoy my days. I sometimes, let's say it's a very busy week, you have so many calls, you have difficult patients, but I go home happy every single day. I might be tired, but that's normal. I'm human, but very, very happy. And I would say that having fellows that goes in the same path like you, with the struggles and the sacrifice that imply, it's very important, because they keep you on flow, because they understand what you're going through. One of the things that really I remember, and is that all my uh, high school students, fellows were graduating first, and me, I was the only one who went into med school, the only one. So they were graduating at 5 years, and I still was depending of my parents. And I graduated when I was 24 to 25. And imagine, they almost were married, having kids, buying cars, and I not even had a car. I was going in bus back and forth, and I was not independent. But that didn't stop me, because I think the dreams and what makes you happy is beyond those material things. It's like my dreams were beyond those things that I will eventually achieve. And look at that. I'm now living a beautiful life that I dream of. It's wonderful. So just follow your passion. That will be my advice. Really be clear in the goals and objectives, and don't see it like a sacrifice. See it like is the investment you have to make at this moment to pursue what you will eventually get to do, that will give you so much rewards. And they are rewards that are priceless. No MasterCard or Visa can pay that. I'm going to stop here, and I will pause for you to ask me questions.
So if nobody's asking questions, I'll go ahead and ask one. Do you have
They are
any?
very shy.
Yeah. So do you have any tips or advice on how to network for college?
Yeah, I think these days you have so many opportunities online to belong to a group. I would say that my version of what I see happening in the United States is definitely you need a lot of kind of ways to prove that you really want to pursue this career, meaning very much in being involved in the community, to participate, for instance, in the Westminster Clinic. That shows that definitely you want to see patients, care for them. It gives you a learning because you will be either helping, assisting them to take the blood pressure. You can shadow physicians. You can write for them what they're talking, so you're going to be familiar with some terminology. That is a very good opportunity, and they are in our community. We have one in Oxnard. We have one in Thousand Oaks, so Westminster Clinic. It's a free clinic for the underserved population. And the networking, I would say, you need to be surrounded by people like you, people like wants to get to where you want to get, because they are in the same symphony. And I think that would be important. And volunteer, because you're going to get to meet people. And generally, when you meet one, it's going to lead you to another. Oh, I'm going to recommend you with this. That happened to me several times. So when they see your enthusiasm and your hard work, they will be opening doors for you.
Okay, so another one is what do you need to study or major in if you want to be a doctor?
I would say that it varies. I think this country has the beauty of the flexibility, and whatever you do, if you do it very good, it talks about your focus, that you're goal oriented, that you are determined and committed, and you will work hard. So, but if you go details, probably biochemistry is important, biology is important. So I would say that those tools are highlighted important. And Dr. Burstein, I'm sure he has hands-on experience with his family. He will tell you more about it.
Okay. What is the process of medical school admission? So like taking the MCAT, the classes.
I can't comment on that. I will let that to Dr. Burstein. But just to give you a little bit more of what's happening in this society these days, and I can talk about the Kaiser Permanente School of Medicine. Definitely, we are working super hard to have a more inclusive and diverse medical group. And when I say medical group, I'm not talking about just Kaiser, but overall to provide services to all our diverse population. So they are considering all those variables, but still they're choosing the best candidate always. And how you prove that? On paper. You prove that on paper, right? You can go and do the best interview, and that it's important, but there has to be some proof on paper. I'm talking about scores, involvement in the community, and things that connect to each other, that makes the puzzle to look like you want to be a doctor.
Okay. So can you just describe what the day in the life of a physician is?
Oh, wow. It's awesome. I wake up very, very early every day, 5:30, get my kind of exercise routine that is mainly stretches and mindfulness. And mindfulness can take you a minute. Then get a power breakfast that is very healthy, share with my husband. Then get my daughter ready, get in my car, listen to music, talk to friends, get to my clinic, salutate all my staff that are wonderful, and get ready for my clinic. Generally, I have 10 to 11 patients in the morning. Every 20 minutes, I see a patient, and then the same amount in the afternoon. And these days, we have the ability to provide services not only in person, but also on the phone or on video. So that is a new kind of way to provide medicine. It depends of the cases. I have a practice that is mainly internal medicine, so I don't see kids, I see adults and very senior patients with many, many, many medical problems. And the main thing I do is I am the coach. I am the person that will help them to identify, like a good detective, what the problem is, and to bring from them what are the best solutions that can work for their particular lifestyle. So what we do is a kind of a mindful discussion of the opportunities, the areas for improvement, and we go one at a time, maybe two. And I'm one of those physicians that try not to prescribe too many medications unless it's needed, and generally it's related with infections, but more to give them tools and a clear understanding in why they ended having that problem. And that's my day. I recharge. So I finish with one patient and I join one. It's like a fresh new start, because each of them will be so different. and diverse. So that's what I love to be a doctor. Is every patient is a world.
Okay, does anybody else have any last final questions for Dr. Diaz before she has to leave? Any last final lingering questions? Everybody's so shy. Okay, Dr. Diaz,
Guys, yes, I want to just give one more thing. So you are about to experience one of the kindest, warm, and fun doctors I've ever worked with. So please ask questions because it's also about having fun. So when you get in the room, it's about how to kind of see the patient perspective and try to help them from their perspective using your knowledge. So that's who we are. I'm not a god, I'm not a fixer-upper. I'm just a coaching help and a good detective to try to figure things out with them. So thank you for the opportunity. I wish you all a wonderful career, no matter where you go and what you choose, but to enjoy it from day number one. And the struggles make you stronger, okay?
Dr. Diaz, you're an
Kisses.
excellent doctor. So thanks for
Oh, no, come on, Dr. Burstein, you are too. Thank you so much, guys.
Bye.
Enjoy. Bye.
Thank you, Dr. Diaz.
Thank you.
Okay, she's amazing. I love her. Okay, so now we're gonna pass over to Dr. Burstein.
Hi, I'm Walter Burstein. I'm more shy than Dr. Diaz, so I'm not necessarily a leader, but I'm an advocate for my patients, and so that's how I got interested. But I also came from South America, from Argentina, instead of Venezuela, and I came at a young age and started school here at 4th grade pretty much. Went through high school and then went to Chatsworth High School, Cal State Northridge University for a couple of years, then transferred because my parents moved to Orange County. I moved with them and I commuted to UC Irvine, which was my last 2 years of undergraduate school. After that, I applied to many medical schools and got into the one I eventually went to, UC Irvine, plus a few others. But zot, I agree. What's interesting is that when you apply for med school, you have to apply to many med schools. It's very difficult to get into med school, and sometimes you just get one, and that's all you really need. Sometimes you get many, and you get to choose. As far as what made me interested in medicine, my parents worked really hard in the catering business, and I helped them out during high school and so forth. And they always wanted us to have a good education. So my brothers and I all went to professional school. My younger brother went to med school, also became a doctor, and my older brother's a dentist. But one of the interests was I really loved science, and I like helping people, and I thought the combination would be a good fit. And so that's how it started. As far as I feel that since you're high schoolers, it's very important to know that although it's good to do well in school, in high school, I don't think in our system it's that important to be the top of the class. I think it's important to get in a college, but there's so many good universities out there. So I wouldn't feel bad about not getting in the top schools. Nowadays, it's really difficult to even get into a UC school, extremely difficult, and especially with the pandemic and everything. There's been delay in application, and there's a lot of applications going on right now. And so if you don't get to UC school, so what? I went to Cal State Northridge a couple of years. I thought I got an excellent education there because you have smaller classrooms, like 30 people per class, and I learned the material very well. And then what the med schools I think are looking for, they're looking for how you do also not only the grades, but also how you do on the MCAT, or medical admission college test, medical college admission test. So that's kind of a unifying test. So you can see how people who went to Harvard did compared to people who went to, for example, Cal State Northridge. It kind of puts you all in the same place for comparison. I think it is important to do volunteer work because they do look at that. So if you want to go to med school, I think it's important to do some volunteer work and maybe do some research in college. But
Dr.
yes,
Sorry to interrupt you, but we
no
have
problem.
from one of the or two of the students the same question. It's how much were you involved with your community back in high school, and any volunteer work you recommend?
Yeah, so I did do a little volunteer work in the hospital. There was Northridge Hospital, which turned out to be the place I went to residency. Kind of a coincidence, but I just helped. I went to the hospital, said, "Do you need any volunteers?" And I would just transfer patients from place to place. And later on, I was able to go to the emergency room and observe the doctors do things like suturing and taking care of people. And later on, I actually did, because I speak Spanish as well, I did some interpreting for the doctors at the residency program of family medicine, which turned out to be the place where I will go many years later, where I did my residency. So that's how I got some exposure. My family didn't have doctors at that time, so all my experiences were my own, and I have people around me that could guide me, be my mentor. If you do, that's wonderful. You can shadow them and ask them what they feel about it. But doing some volunteer work is good and important. In college, doing a little bit of research here is important because the medical schools do look at that. But don't let your grades go down in college. College is where you have to do very well. You should be the top, I don't know, 5 or 10% of the class probably. And I would do a preparation class at that point before you take the MCAT, because it's a very difficult, like a 7.5-hour test. And it tests your endurance besides your knowledge in multiple fields. So at that point, before you take the test, you would do a preparation class, where you can do prior tests and just do one after the other until you get a feeling what the test is going to be like. So I really enjoyed my career. I loved working with my patients. I think that they put trust in me, and it's a heavy responsibility. Don't get me wrong. I feel the burden in one way, in the sense that I want to do the best I can. And it's a difficult job because people, especially in primary care, you have people coming in with multiple complaints, sometimes concerns. And you have to be able to deal with several things in a short period of time sometimes.
Can you describe more your process with the MCAT and your admissions?
To the application for medical school?
Like that whole process?
Yeah, it's been a long time, but things may have changed. I think there's an organization like AMCAS, it's called, where you submit your applications to multiple medical schools. You do have to pay some sort of primary application fee to each med school you apply. And then there's secondaries where they call you back and you do an interview at that point. And then after that, sometimes there's a waiting time. Sometimes you get in a waiting list. Like I got into Tulane Medical School and USC, but I really wanted to go to UC Irvine because it was closer to my parents. It was cheaper. That was a big one too. And so I got in the waiting list and I got in. It happens that sometimes the best applicants get accepted to multiple medical schools and they have to drop off or reject some of their people who accepted them. So the openings come up later. One thing I just want to make sure people know is that you really, at high school, it's good to have an interest, get exposure to see if you're interested, and do as well as you can, but don't get too stressed, in my opinion, about which school you go to. Do very, very well. Also, don't worry too much about the cost of medicine. Medical school is expensive, almost, I don't know, an average is probably $250,000, and that sounds like a huge amount, and it is, but you can borrow the money and you'd be able to pay it back over many, many years, and you're secure financially in medicine. So that is a reward that we get. So we have to admit that that's part of the reward, but the biggest reward should be helping the patient. When I go in a room, I try to sit down with the patient, never stand up, and face to face and try to listen to their concerns instead of working with a computer or standing up. So you're there for your attention has to be right there with them, and you have to care for what you do.
A couple of questions I see on the chat is, I know this might be a bit too soon for me, but if I want to start looking for internships, where do you suggest I should start?
Okay, well, the good thing about this process is that it's a long process. It's a very long process. And so in college, you'll be working hard to get your grades, to do your volunteer work, your research, and then taking the tests for admissions. But in med school, you'll get exposed to different specialties. The first 2 years usually are academic and tend to be sometimes a repeat of some of the college material. Like you may get biochemistry again, which you probably took in college. Some require it. Physiology, some people have had, not everybody. So luckily, I think that's good actually, because there's so much material coming in that it's difficult to absorb so much material. But the answer to the question is the third and fourth year, you get exposed to different specialties. And at that time, you get an inkling of what you would want to become. A surgeon, a neurosurgeon, an endocrinologist, a rheumatologist, a gastroenterologist, a family doctor, an internal medicine doctor. So there are a lot of choices, which I think is wonderful because it allows you to kind of fit something that fits your personality and your abilities. As far as which ones are good in each specialty, that's something I wouldn't know when you apply to your specialty that you're interested in. Usually in the fourth year, you do a rotation so that they get to know you and you get to know them and see if it'd be a good fit. And then what happens is something in March called match day. This is way ahead of you guys, but it's interesting. In match day, basically after you applied to multiple places at residency and you interviewed in a few of them, you put the residency of your choice in a list, 1 through however many you want to put in there. And the residency puts their choice of their candidates 1 through however many they want to take. And the first ones that you match that they want you, that's where you go. And you don't know that until a Friday in March. And there goes your future. You open it up and there you go. It could be somewhere in Texas or California. You don't know where you're gonna go until that day.
So another question is, how do medical schools care about what college we attend? So I'm guessing for undergrad.
My view is only a little to none. I mean, if you go to Harvard, and as an example, I don't know why I chose Harvard, but if you go to Harvard, and it's probably very difficult to get good grades in Harvard, and you go to a Cal State school where it's a little bit easier, they might, if you have the same grade, they might think the person at Harvard is a higher ability, but they really look at the MCAT test to kind of differentiate. If you have the same score as somebody from Harvard and do better than them in this medical test that you take before applying, then all bets are off. You can go ahead of the person from Harvard. So in other words, don't stress too much. I see kids from high school stressing about where they're gonna go.
Another question is, how would you describe your interview of your first residency?
Let's see, I think I interviewed, okay, I will describe it. So the one I first went to is actually the one I ended up going to. It was Northridge Hospital, and we had a wonderful Dr. Greengold, who was the director. He interviewed me, and he put me in a dark room. It was not totally dark, black, but pretty dark. And we talked about my life, and he got to the inner feelings of me. And he would do that to many of the applicants. He would have some of them, applicants would cry because he would bring out some issues that were deep in their soul, kind of in a sense. So he was a very good interviewer in the sense that he was able to understand the person. But most interviews weren't like that. Most interviews are just basically getting to know you, see what you're interested in their program and why you want to go there, basically. And they may ask you about your past.
Dr. Burstein, I have a personal question. I
Sure.
was just wondering, how did you decide your specialty for your practice as a physician?
That's a good question. I think I was kind of blind when I went to medical school in the sense that I didn't even know there were so many subspecialties, right? I thought that being a doctor is a doctor like Dr. Welby, you come in the office and you take care of whatever problems show up. So that was in my mindset. That's what a doctor was. So when I went in, I kind of thought I was going to be a clinical general doctor, like a family doctor or internal medicine. So that was my thought at first. And it was reinforced because I don't get bored. I don't know. Some subspecialties are so narrow and you can know everything about it, which is wonderful. That's wonderful. But I went to family medicine, which is the jack of all trades, master of none, they say. You're not a master of any of them, but you're able to help so many people out in a visit because you know so much about different things. And you do it often enough that you get pretty good at it. Now, you don't always take care of everything in the office. Sometimes you have to refer, which is fine. One thing that I want people to know is that when you become a doctor, it's very important to talk to your colleagues, to utilize them, to learn from them, because medicine is very humbling. It's very, very wide and knowledge is overwhelming. And we have the benefit of computers, that helps a lot. But there's just a lot of information out there, and that's why we have subspecialists. So, and the other good thing about computers is that I could do a referral without the patient going to the subspecialist. And Southern California Permanente Medical Group, which is Kaiser, I can send a doctor advice to a subspecialist and say, would you like me to send the patient or how would you work this up? What would you do? And often you get excellent responses and you learn from that too. For the next patient that has that, what to do. So, yeah.
And I guess kind of following up, could you describe like a memory or a patient that you've had that was just memorable as a family practice doctor?
Well, I've had so many. Let me think about that. Well, it's hard to say one person. I do remember patients that I had from the beginning, the first day, basically in Camarillo. I had a lady that followed me all the way through my career, just a very nice lady that had rheumatoid arthritis and bad spine, but very, very sweet and had to know her over many, many years. I've had patients where I remember that they had, for example, an illness that could have killed them that luckily I was able to diagnose on the spot and say, oh yeah, I did a good job. And they of course love you for that. So there are things, most of the time it's not like that. It's not like watching ER shows, where 10 things happen at once. You usually have time to try to figure them out. The key though is paying attention.
Thanks, Dr. Burstein. I'll pass it back to Casey.
Okay.
So a few questions that have come up was, do you have any obstacles that you had to face when you were in undergrad or med school?
Well, undergrad, I was very focused. I mean, I didn't party that much. I had a few friends, but I did mostly just do the work, and it's between research and volunteering and then doing the studying. If you want to do well enough to get into med school, you have to really focus. So I was able to do that, and I didn't have too much difficulty there. In med school, the amount of information that you get is tremendous. So I don't remember the number of credits equivalent, but something like 52 credits. I mean, it's just basically you're in class from 8 to 5, lectures nonstop except for lunch, etc., little breaks, and then you go study at night. So it's a very long day, so the obstacle there is keeping fit, being able to take care of yourself. I think I was able to do that in medical school pretty well. It kind of fell down in residency because residency the first year, 100 hours a week, pretty much in residency. So that's quite a bit of hours. The reason was that there were no rules. Then you can go 36 hours and then you go home, overnight sleep, and you come back and you do your regular shift, which might be 10 hours. So over a week, it's basically 100 hours of an internship, and little less than second year was maybe 80 hours, third year about 80 hours. So now I think they have some rules that make it a little easier. My daughter, who's now in residency actually in family medicine, also very proud of her. They have some rules, but they kind of bend them in a way. What they do is, okay, you're supposed to work no more than 80 hours a week, but okay, so you work 100 hours, well, 90 hours this week. Next, in a month from now, we'll put you at 70. You know what I mean? So they average it out to be 80 hours, but it's still a lot of work. It's probably better than it was before. As a physician, in order to do a good job, I think it's important to be happy inside, and to be that way, you have to have time for your family. You have to be able to try to exercise. You have to stay mentally healthy so you can empathize with the patient. That's not always easy, but it can be done. It can be done. The good thing about primary care, family medicine, and some medical groups like Kaiser is that you can work 90% time instead of 100% time. So you could take that 1/2 day a week or so and do something else. I coached my 3 children through soccer for many years. I forget how many years, but 10, 15 years probably. I did some roughing and other things that are fun. And that I bonded with my kids. At the end of it all, you want to make sure your family's happy too.
Another question is, can you describe the responsibilities of a family physician?
Okay, so it really varies, but I'll go over my history. I didn't really fully finish, but so out of the 32 years, I did maybe 15 years where I did both outpatient clinic and hospital. So at that time, I was really busy because I would have to round in the hospitals before I went to clinic. Because once you're in clinic, you're not in the hospital. You can't be at 2 places at once, really. And at that time, there weren't really that many hospitalists, which are currently the thing to have. At that time, you would follow your patients if they got sick. You would see them in the hospital, round on them, go to the clinic, round on them. And if you have nursing home patients, you might go at lunchtime. So it was really very difficult. And I would have call at night and sometimes wake up in the night and go, and then have to go to work the next day. But things are better now. Well, they're better, but they're also, you get less experience on, so you can't have everything. But so the first 15 years, I got experience on when patients look really sick, so I know when to send them to the hospital, when they look like they're not going to do well. But I also, and then with the second 15 years, it was more organized, had more time. I had more colleagues helping me with the patients, which makes sense. People that are called hospitals or doctors that just work in the hospital. They would take care of my patients, discharge my patients, tell me about what happened in the hospital, and I would follow through. So there are many careers within medicine. You can work in the hospital, in an outpatient clinic. You can be a doctor that still does it all, but that's very unusual now. I think you have to be in a rural area. And as a family doctor, I do see the gamut of patients from birth till really death, till really elderly. But yeah, so that's what I do. I'm semi-retired now, so in a sense, I'm working very little now, but that's just something I have planned over time, and I'm doing more things in the family.
I have a question. So how do you know when a patient has a particular disease, or how do you detect it as a physician? Is it just based on the symptoms, or how do they teach you that in medical school?
Yeah, good question. So first you learn the physiology and what can go wrong at as many steps as possible. You learn about the disease. It's called pathology. So you kind of learn about that. So in the back of the mind, you have a lot of information. All that cramming you did in medical school is there somewhere. And then in residency, you learn on the job, because that's really where you learn most of it, the clinical aspects of the disease, having people who have a lot of experience looking over you. So you learn a lot in residency. But they say that about 90%, and I believe it, about 90% of the diagnosis is in the history. So that's why I say that if you want to be a good doctor, you better pay attention. Because it's easy to say, think in your mind, okay, the person has a cold or whatever, and not follow through because you're not really listening, and then the person has something bad. But you have time to learn, and I'm not trying to scare anybody.
Do you prefer a hospital setting or clinical setting? Like, what are the main differences you notice?
So the hospital setting is interesting because you follow the patient through from when they're really sick, and usually they go home much better. So that's a very positive thing that you see in a few days change. So there's a lot of good in that. In family medicine, it's really unusual to be a hospitalist. There are occasional doctors that go through family and then do hospital work, but it's unusual because you get training in different things like pediatrics and gynecology, obstetrics more, and less in the one area that hospitalists work with, which is internal medicine. So it's like getting somebody with a little bit less training in that one area and only doing that area and ignoring the other parts. You see what I mean? So in that sense, it's unusual to become just a hospitalist, but for family doctor. But there are doctors that follow in a clinic and they know their patients very well. So when they go in the hospital, they know what they were like, and what their baseline is when they improve enough to go home. You might know a lot through that. So there's a lot of positive, you see a lot of improvement there. In the outpatient arena, it takes a long time sometimes to make a difference. The reason is hypertension, high blood pressure. You have high blood pressure and you treat it well, you prevent a stroke and a heart attack, which that's what you want to do, obviously, but you don't see the prevention. You just know that they were okay. You see what I mean? So you see him many, many years taking care of that one problem. You don't see a quick improvement. You do see some improvement on the vital signs, etc. But it's not like having somebody who's really ill in the hospital and getting them better and sending them home. So they're two different kind of situations. You do see people not in the office though, but sometimes might come with appendicitis or a cut that need to suture, different things. So it's interesting also.
Actually a question I have. So I know for a medical school, you do rounds.
Yes.
What was your experience with the surgery? I think that's one of the rounds, right?
Yes. So that's a very good one. So my experience is that you feel a lot of pressure. So you're rounding and you have the attending and you might have 3 medical students around with you. And we call pimping. They ask you a question and then if you try to answer, and if not, you go, no, you bug the next one. And you feel pressure to answer correctly. And it's funny because I'm laughing because one time I was with a friend who went into orthopedic surgery, but he was so stressed and so hyped up that he fainted while he was doing that on the rounds. But it's just because emotionally he was so into this, doing the right thing. But
Oh my gosh.
but yeah, so it's interesting. You do learn a lot, and it just takes, you learn your whole career. When I graduated medical school, there was a doctor who said something that I thought turned out to be very true. And he said that we've taught you 50% of what we've taught you is wrong. I just don't know which half. You understand that? So basically, because medicine is an evolving science, if you call it science, a lot of things that we're taught are wrong. So are wrong not because they want to teach us incorrectly, it's that we don't have enough information. And over time, it's maybe not 50% wrong, maybe it's only 30% wrong, but things change and it goes in cycles, and you have to be willing to change your way of practice. And it's not always easy, because if you practice 20 years a certain way and you find out that it's not the right way to do it, you're supposed to change, so you have to be willing to adapt. So to be a good doctor, I think you have to be willing to adapt and be very focused and caring.
One other question is, how many years of schooling did you have to complete in order to become a family doctor?
So family medicine is 3 years of residency after medical school. I think internal medicine is the same. Most other ones are longer. So if you want to become a surgeon, it's usually 5, OBGYN is 4 or 5. neurologist 4 or 5, and then so plastic surgeon 7. So they're really long residencies. You do get paid, so you don't have to take a loan during that time. Not a lot, but you get paid enough to survive. So at least you do that. That's okay. It's just a lot of effort. So a lot of times people, especially if they have a family, they may wanna they tend to go through the primary care instead of long residencies.
So about 7 years.
For well, med school and family medicine together is 7 years. In Venezuela, Dr. Diaz was saying that you can go from high school to medical school. Here, you basically can't, except for a few exceptions. There are a few med schools that combine college and medical school into 6 year instead of 4 years, the usual 4-year undergrad and then 4-year medical school. So you could look for those. It's possible. I don't know if I recommend it or not. I think college is also, you grow up a little bit during that time, and if you go directly into medical school / college, you save a couple years of your life, training, but I don't know if you get the whole experience. So I'm not sure. It depends on the person, but it is possible. So it's just, I didn't try to do that.
So this is actually a good question. So with new medical advancements, how often would you say you've had to update yourself on current medical findings?
Well, we're supposed to be reading regularly. So I think the Board of Family Medicine requires 50 hours of education every year. So you read or go to conferences. Luckily, nowadays with computers, we have very good systems. We have something called UpToDate, for example, and it's just a tremendous amount of data. You can just search something, a disease or symptoms, and you can read about it right there. So in a sense, you're learning all the time because a lot of times you don't know and you have to check, see what's the best treatment. So if your doctor goes to the computer and starts looking to see how to treat you, don't think he's not a good doctor. He's just trying to do the job for you.
Another one is, did you have to attend seminars, and how would the practice place that you are working at ensures that you attend it?
Oh, well, it depends on the medical group that you work with. So that's one thing I would look into before you accept the job, is to see how much, if you get CME time for conferences. And if you do, that's great. And then you attend. It's in an honor system as far as whether you go to the class. I mean, if you don't go to the class, I mean, I don't understand why you would go to the conference. You're going there to learn. You probably sign in and you go in and you try to learn. That's a good question.
Oh, another one. I accidentally skipped this one. Throughout your journey pursuing the field you're in, was something you were glad you did, as well as something you wish that you had done?
Okay, let's see. I wish I had done a little bit more fun stuff in college. I did do intramural soccer, but mostly when I was in med school. And, I didn't do much other than do my prerequisites that I needed, but I didn't do as much fun activities. The other thing I would say for you high schoolers is that do something that you enjoy. Don't be too stressed. Life is short, and I mean, you have to put a lot in. In medicine, it's interesting. There is a study that they did. I mean, I briefly know it, so I don't quote me in this, but there was a delayed gratification study they did in kids. Have you heard of that, Cassie? So
No.
so back in, I think Stanford, they had kids that were 4 years of age, and they offered to get them a marshmallow, and they can get it right away, or if you delayed getting it, you would get 2 or a better treat. And so these kids that delayed the time and kind of started fiddling or got agitated by trying to find ways to wait the time to get 2 instead of 1, they're the ones who tended to do better. They looked at them 10 years later and they were more competent, did better in their SATs and all that. So what I'm saying is, it's hard and you're delaying gratification, but you get it to a higher level than you would have. So, I mean, in a sense, that was a requirement, you know, to get ahead. So, yeah. I think I would have gone into medicine a little bit more open-minded about the subspecialties. I was kind of closed-minded about, although I enjoy what I do, and I think it's still one of the best subspecialties, but I was, I didn't know all the available specialties until, and it's difficult because you have to decide by the third year, and you're just beginning pretty much, third or fourth year, you're just beginning to look at the subspecialties, and you have to start applying, you know, in the early fourth year for rotations. So sometimes it's difficult to know what you gonna become.
Another question is, are there any differences in MD and DO degrees in terms of schooling and practices they can engage in?
And because I did the MD training, I don't know exactly the DO training, but from my experience is that both equally competent, in my opinion. That I think the doctors of osteopath probably have more training on hands-on manipulation and things like that that we didn't get. But for some reason, the only thing I would say is that it might be harder to get into the hard sought after subspecialties as a DO unless you're top of the class, versus somebody who's maybe the top third who might get into something that is difficult to get into through med school. Now, is that right? Is that fair? No, but that's just the way it is from my experience. So keep that in mind, but I would, if you're really interested in medicine, I would also consider, if you're not sure you can get in medical school, which is very difficult, I would consider applying to doctors of osteopath schools too, because after that training is done, the residencies are the same and they're intermeshed.
So do you notice any like health disparities within healthcare with people of color or anything like that?
Yes, well, we do know that people of color have higher rates of stroke and difficulty to control blood pressure sometimes, some diseases like sarcoid and some strange diseases that are available. But every group has their own genetic predispositions. But the problem is that I think that people don't have access to medical care. That's the biggest disparity. I think once a person of color comes to a doctor, I think they'll be treated fairly and, you know, as well as they can. You know, I do think there's an understanding maybe better to have, sometimes it's, if you're in the same ethnic group, you might understand that person better just because naturally you're from that ethnic group. But if you're open and you're willing to listen and you're perceptive, you can be any ethnic group and take care of anybody else pretty well, as long as you're open and willing and do your studying and do as well as you can. I think you can do that. But I do think there's a very good reason to get wide diversity in medical students because we have a diverse population. We should have from every group.
All right, so I think we've reached our time. Thank you, Dr. Burstein, for joining us and taking time out of your day. Do you have any final comments or thoughts for the students?
No, just if you have a passion, go after it. Don't stress too much again about which college. And you can do well in any college and get into any profession you want. I didn't answer one thing that basically if you didn't go into medical school and decided a different path, can you go to a different path? Yes, you don't have to have any specific major to get into medical school. But you should see a counselor to see if you want to become a speech pathologist, for example, then you can see what their prerequisites are, but you do have to do some prerequisites for medicine. So in other words, most medical schools require organic chemistry, inorganic chemistry, physics, excuse me, English, calculus, basically. Those are the main ones. There might be others, but so you could still do speech pathology, for example. That's not in the medical field per se. It is in medicine, but not. But anyway, you could do that with, but if you want to go to medical school, you also have to do those prerequisites. So look at it early and see that if you don't decide not to go to medical school, can you use the information that you got from the courses you took to go another course? And the answer is yes. You can go to nursing, which is a wonderful career. You know, an example, physical therapy, for example, speech pathology, a lot of things. I can't come up with all of them, but I hope you enjoyed it, and I hope I didn't talk too much.
No, I enjoyed it.
Yes.
Thanks.
Thank you so much, Dr. Burstein.
You're welcome. It's a pleasure.
To all the high schoolers, we do have a couple of announcements. So let me just share my screen. Okay. So the first thing is just a reminder of all of the other workshops. So we did our second workshop today with our career insight from Kaiser physicians. Next week, we'll have insight from UCI medical students. And after that, we'll have different pathways to a career in health. So if you're not interested in medical school per se, but you're still interested in a health career, we'll be talking specifically about nursing, pharmacy, and physical therapy. The next two are a little bit more, not career oriented, but a little bit more fun. So this one's about the science behind our skincare. So if you've ever had a problem, like maybe you were in Walmart and you're trying to figure out what to buy in those aisles, or you have a skin condition that you are worried about, this would be a good workshop to attend to figure that out. And the last, we have received questions about health disparities, so we do want to address this. It is big in medicine, so it's very important for physicians and just healthcare workers to know about. So if you're interested in that, that's on May 21st. Okay, my second announcement is, I'll put this in the chat. A lot of you guys were asking about internships or like experiences that you can join and participate in. And this workshop was funded by the Free Clinic Project, CHAMP. We also have another project that we're doing called SREI, Summer Research Enrichment Internship. And basically this is a project for high schoolers to get exposed to research and conduct. So you'll be able to conduct your own research, research project and meet professionals from UCI that do research. So professors and researchers, as well as undergraduate researchers who will be your mentors and guide you through a research project. So if this is something you're interested in, Dr. Burstein did say that if you did want to get into have research experience, I think that this would be a good place to start. We're not looking for people who have had experience in research. We know that most high schoolers don't have research experience. So we're not looking at grades or anything like that as well. We're really just looking at your interest in pursuing research. So do apply. I think the deadline for the application is May 4th, but don't quote me on that. Follow the link that I sent and it'll have the deadline date on there. Okay, and yes, it is online. It's going to be over Zoom, unfortunately. It has been traditionally at the UCI campus, but last summer and this summer, we've had to conduct it online because of the pandemic. Okay, and that is all for my announcements. And yes, finally, last thank you again to Dr. Burstein. And
Thank you.
You're welcome, Cassie. Take care. Have a good day.
have a good day.
Bye-bye.
And what time is the internship? It's going to be every Monday, Wednesday, and Friday. The exact times are not yet set. Monday, Wednesday, the exact times are not yet set, but they will be emailing you if you're accepted more specific details. And it is completely free. Yeah.
The evals.
Oh, yes, I can send those as well. The last thing that we wanted to ask is we do want to keep improving our workshops. So we know we do listen to all of your comments. So we do have an evaluation that we put here. Does it mean that when this is over? No, so for right now, it is eligible to all students. It doesn't matter if you're in Irvine or not. Hopefully we'll be able to, even like next year and the following years, we intend to keep it eligible for all students. We'll work. That's a good question, Koa. I'll bring this up to them so that way we can still keep it eligible for everyone, even if you're not in Irvine. Yeah. Some other questions that I see that we couldn't answer was like more opportunities for volunteering and internships. So we'll try to keep making sure that we're researching this for you guys. And if we are able to, we'll try to make a list and set that we can share with everyone that you guys can look into. Yeah. Have a good rest of your day, everyone. Thank you for attending our workshop.
Bye, guys.